This dental phobic patient was referred to us for endodontic treatment of tooth number 11. Porcelain crown on the tooth, and you can see a periapical relucency right there. That's why it's important to tell your dentist or the specialist that you are referred to during the consultation visit. It's important to let them know that you have dental anxiety, dental phobia, because we have ways that we can manage that for you. Well, this patient didn't let us know during the examination, that original examination, initial evaluation, that she had dental phobia. She only told us when we were ready to give her the local anesthetic and get it going. She started to shiver, shake, and hyperventilate. We were able to calm her down, but she did fine after the initial injection, the local anesthetic. But we could have done a lot more. We could have probably perhaps sedated her or given her oral anxiolytic to calm her down, to calm her nerves. But anyways, it's important, if you are a patient, if and you ever need a root canal, uh, please let us know beforehand that you have dental anxiety, dental phobia. There are ways that we can manage that for you. You don't have to suffer. This patient didn't suffer, but um, she was very anxious, very nervous. She was shaking, as I said, and hyperventilating. And if she had told us that she had dental phobia, we could have addressed all of that. So she didn't even have to shake and shiver and hyperventilate during this appointment for a few minutes. It was just a few minutes, but it could have been easily avoided. Anyways, so today went ahead and went through the porcelain crown and did this root canal for her in one appointment. Let's take a look. And here's the post-op. Working length was 27 millimeters. 27 millimeters. And take a look at the apical area here. And then bifurcates. So one canal and then bifurcates. The apical few millimeters, there was a nice curvature there. And that curvature was actually towards the buccal or labial. So it was this way. That's why you see that round um, radiopacity. So the end of the root had a curve, and the curve is kind of like that. All right, and there is a little kind of bifurcation, as you can see there as well. Everything went great. Because this patient had dental phobia, she requested, please don't put a temporary filling in there. Then I have to go to my dentist and get more injections to have the temporary drilled out and permanent filling put in. Just please go ahead and do the permanent build up yourself, and that's what we did as well. So did the root canal and went ahead and put the permanent build up in for her as well. She doesn't need a new crown. The crown is fine. This patient was referred to me for endodontic treatment of this calcified tooth number 8. As you can see, tooth is extremely calcified. He cracked it, and he had some symptoms associated with the tooth. So today we went ahead and did the root canal for him. I used a surgical operating microscope, so I was able to locate this canal. I'm not exaggerating, in about maybe a minute. Took me a minute. The apex locator was acting up, so I went ahead and, like, my nurses took took care working length radiograph. This is a 23 millimeter number 20 file. So as you can see, I'm about a millimeter over. So actual working length turned out to be 22 millimeters. And here's the post-op. As you can see, everything went great. Got a little sealer extrusion. Again, sealer extrusion does not cause endodontic failure. Everything went great. Left a starter post space for the general dentist. I call this starter so they can follow the path, and if they want to remove more, they can remove more gutta percha. But as you can see, everything went great. Went ahead and temporized the tooth and referred the patient back to his dentist for the permanent restoration. My root canals don't fail. I do excellent root canals. None of my root canals fail. Yeah. You think none of your root canals fail because your patients likely don't come back to you. They go somewhere else. Doc, these root canals look so good. Why did they fail? Why did they fail? They look good. Can you see by looking, just by looking see bacteria in the canals? Can you by looking know if this dentist used a rubber dam, used hypo, irrigated, copiously activated, all of that stuff? No. Pretty white lines on an x-ray don't mean anything. Also, take a look at tooth number 21 here. Looks like there's a misroot. Look at that. Look how fat this tooth is, right? This is how fat this tooth is. Look where the gutta percha is. If this was a one-rooted tooth, the gutta percha would be pretty center, but it's not, as you can see. There's this much dentin on one side and this much dentin on the other side. Look at the difference between the thickness. So that tells me there's another root. There's another canal here. Tooth number 21. All right. If you can't read x-rays, you're in trouble. That's what happens if you can't read x-rays or you don't follow the fundamentals of endodontics. This patient was referred to me for endodontic retreatment of tooth number 19. According to the patient, this root canal was done a little over a year ago by his previous dentist. Not the current dentist, the previous dentist. But take a look here. Now, what do you see? Build up, of course. Coke bottle, preps, almost always sign off what? Gates Glidden files being used. As you can see, right there, right here, you can see Coke bottle, Gates Glidden. Short fills, that means short instrumentation likely because you got a periapical lucency here. All right, so this dentist didn't go to proper working length. All right, the other thing is that's a broken file. This patient was never told about this.